Hello and welcome to Pregnancy Info. Today we will discuss the causes, treatment and types of episiotomy. What is an episiotomy? An episiotomy is an incision or cut through the area between your vaginal opening and your anus. This area is called the perineum. This procedure is done to make your vaginal opening larger for childbirth. Who should give this episiotomy treatment? Not all women need an episiotomy. Stretching the tissues naturally may help reduce your need for it. Ask your healthcare provider about how to do this on your own. Without any episiotomy, your perineal tissues may tear. This can be harder to repair. Your provider may advise an episiotomy in these situations. Number 1. The baby doesn't have enough oxygen. Number 2. Complicated birth, such as when the baby is positioned bottom or feet first, or when the baby's shoulders are trapped. Long post-stage of labor, forceps or vacuum delivery, large baby, preterm baby. Your healthcare provider may have other reasons to recommend an episiotomy. How you can get ready for an episiotomy? Your healthcare provider will explain the procedure and you can ask questions. You will be asked to sign a consent form that gives you permission to do the procedure. Read the form carefully and ask questions if something is not clear. The form may be part of the general consent for your delivery. Tell your healthcare provider if you are sensitive to or allergic to any medicine, iodine, latex, tape, or anesthesia. Tell your healthcare provider of all medicines, vitamins, herbs, and supplements that you are taking. Tell your healthcare provider if you have a history of bleeding disorder or if you are taking any blood thinning medicines, aspirin, or other medicines that affects blood clotting. You may need to stop these medicines before labor. Follow any other instructions your provider gives you to get ready. Here are general 4 types of episiotomy that can be done in different ways and in different countries. Number 1. Mediolateral episiotomy. The incision is made to the right or left side from the midpoint of the forecheek. It runs diagonally in a straight line about 2.5 cm away from the anus. Median. The incision begins in the center of the forecheek and extend from 2.5 cm on the posterior side along the midline. Lateral. The incisions begins about a centimeter away from the center of the forecheek. Because of the risk of injury to the Bartholin's duct, some practitioners strongly advise against lateral incisions. J-shaped incision. The incision begins in the center of forecheek and is directed posteriorly along the midline for about 1.5 centimeter before being directed downward and outward along the 5 or 7 o'clock positions to avoid the internal and external anal sphincters. This procedure is not widely used. There are some degrees of episiotomy. Degrees of an episiotomy is used to document the type of birth cut a woman received to deliver a baby. The degree is determined by the tissues that were lacerated. This assess in guiding management and possible long-term symptoms and outcomes. First degree episiotomy. This cut only penetrates the vaginal epithelial, the tissue lining the vagina. Second degree episiotomy. This episiotomy goes through the perineum muscles but bypasses the anal sphincters. Third degree episiotomy. Only the skin and muscle of the perineum are invaded during an episiotomy. Fourth degree episiotomy. This is when laceration passes through the perineal muscles, external and sphincter and inner rectum lining. Here are some benefits to the mother. Reduction in the likelihood of third degree perineal tears, the preservation of the muscle relaxation of the pelvic floor and perineum, leading to improved sexual function, reduced risk of fecal and urinary incontinence, ease of repair and better healing than laceration because it is a straight and clean incision. Benefits for the baby. It is also suggested that episiotomy increases the ABGAR score of the baby, reduces the prolonged second stage, and may also reduce the possibility of fetal shoulder dystoxia. In some cases, rigid perineum could lead to fetal asphyxia, cranial trauma, cerebral hemorrhage, and mental retardation. Some medical managements are also there. A paracetamol and non-steroidal anti-inflammatory drugs can use pain relief. Laxatives are recommended. Broad-spectrum antibiotics are recommended. In the initial 48 hours, the patient should be placed in the position that will avoid strain on the episiotomy site and help reduce perineal edema. To ensure the wound would be washed and patted dry after toileting, the patient should inspect the wound daily using a hand mirror for any signs of wound breakdown. Physiotherapy management. Such baths help in relaxing the pelvic floor and relieving pain. Ice packs help in reducing swelling and can cause analgesia. RCT suggests that 20 minutes of one cryotherapy applications effectively provided perineal pain relief in women in the immediate postpartum period after vaginal birth with episiotomy. TENS is effective in pain relief. According to RCT, low-frequency TENS and high-frequency TENS applied for 30 minutes near the episiotomy site was found to be safe and effective in reducing pain. Kegel exercises are to be taught to the patients to train the pelvic floor muscles. But other than all these benefits and precautions, some complications are there with this episiotomy treatment. Complications include bleeding, infection, urinary retention seen particularly after instrumental deliveries that may result in urinary tract infections, prolonged voiding difficulties, prolonged wound healing, dyspareunia, pelvic floor dysfunction, urinary fistulas, and inappropriate wound scarring, swelling, tearing into the rectal tissues and anal sphincter muscles which controls the passing of stool, collection of blood in the perineal tissues, pain during sex. You may have other risks based on your condition. Be sure to discuss any concerns with your healthcare provider before. So this is all about the episiotomy treatment as type, causes, treatments, and complications. Share this video with the female who are facing this problem, and also share your comments in the comment section about this video. Take care. Bye-bye.